Ever wake at 2 a.m. with tingling fingers, shake your hands to make it stop, and wonder if the pain will steal tomorrow's work from you?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at Mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're going straight to the source of carpal tunnel symptoms. What's pressing on your median nerve, and what you can do each day to relieve it.
I'm Ilara Sky. If you've noticed numbness, burning, or weakness in your thumb and first three fingers, you're not imagining it. When tissues swell in the narrow wrist passage called the carpal tunnel, the median nerve is squeezed. That pressure disturbs sleep, makes typing miserable, and, left alone, can weaken your grip.
Carpal tunnel often shows up during repetitive work or at night when your wrist bends. Conventional options include splints, anti-inflammatory drugs, steroid injections, and surgery. Some people improve with those, but many see incomplete relief or side effects. That's why attention has shifted to targeted massage and specific exercises that address tight tissues and restricted nerve movement.
Massage techniques such as myofascial release and trigger point therapy work by loosening the tissues around your tendons and relieving pressure on the nerve. With myofascial release, you use a sequence of light strokes, deeper friction with the thumbs, kneading and skin rolling, and gentle shaking. A focused session lasts about 15 minutes and can be repeated in short intervals.
Trigger point therapy targets 3 common pain-referring spots along the arm and near the base of the thumb. You apply firm pressure for 20 to 30 seconds, then stretch the surrounding tissues. Relief can be immediate because these knots often send pain down to the wrist, even when the real tension sits higher up the arm.
Exercises matter just as much. Nerve gliding runs your hand through 6 positions that help the median nerve move freely. Tendon gliding uses 5 positions to restore flexibility. Doing these routines 4 times daily reduces stiffness, improves mobility, and lowers the chance of flare-ups as you go back to everyday tasks.
Simple daily moves add up. Guidance from the Chartered Society of Physiotherapy highlights wrist bends, finger bends, and hand squeezes with a soft ball to strengthen supportive muscles and train tendons to glide more easily. Many people also benefit from splints, one for rest at night to prevent wrist bending, and another for daytime tasks that trigger symptoms.
Consistency sets expectations. You should see easing within 2 weeks, and often steady resolution over 4 to 6 weeks with diligent practice. Keep at it for at least 6 to 8 weeks to lock in results and avoid the cycle of relief, followed by a quick relapse when you stop.
There's also clinical evidence for a fast, structured routine you can do yourself. A study in Rheumatology International evaluated the Maidensi hand massage technique, 3 minutes of effleurage, friction, pétrissage, and shaking, taught once by a physician and then performed at home. Participants who combined splints with this massage had greater pain reduction, stronger grip, better function, and measurable improvements in nerve conduction compared to splints alone.
That last point matters. Improved nerve signal speed shows you're not just masking pain, you're restoring function. The proposed reasons are straightforward: reduced adhesions, better blood and lymph flow, less muscle tightness, and a nervous system response that turns down pain signaling.
Here's how to turn that into your daily plan. First, build a short myofascial release routine. Light strokes to warm the area, thumbs for deeper friction along the forearm and wrist, kneading to unstick tissues, then gentle shaking. Even 15 minutes a day can ease pressure and make exercises more effective.
Second, address hidden knots with trigger point pressure. Target roughly 2 inches below the elbow crease, 2 inches above the wrist crease, and about an inch below the wrist near the thumb base. Hold 20 to 30 seconds, release, and follow with a stretch. You're teaching tense bands to let go so the wrist stops paying the price.
Third, schedule nerve and tendon gliding sessions. Cycle through the 6 nerve glide positions and the 5 tendon glide positions 4 times daily. These motions keep nerves and tendons moving smoothly, so swelling and friction don't build through the day.
Fourth, add gentle wrist flexion and extension stretches after you're warmed up. Hold each for 15 seconds and repeat 5 times. If any movement triggers sharp pain, Stop and return to earlier steps before trying again.
Fifth, choose smart support. Wear a resting splint at night to prevent wrist bending that wakes you up. Use a working splint during tasks that set off symptoms, typing, sewing, or tool use, so you can keep moving while protecting the nerve.
If you're wondering about gadgets, steer clear of vibration massagers. They can aggravate tendon damage and set recovery back. Your best tools are structured massage, gliding routines, gentle stretches, and appropriate splints, practiced morning and evening like brushing your teeth.
You may still be weighing whether surgery is inevitable. The message from these strategies is encouraging. With steady practice, many people see meaningful improvement without moving straight to invasive options. If your symptoms are severe or not improving, pursue an evaluation, but give consistent daily work a real window to show results.
Think about what success looks like over the next month. Fewer nighttime wake-ups, less tingling during the day, and a stronger, steadier grip. Those are signs your nerve pressure is dropping and your function is returning. Keep tracking the small wins so you know the routine is working.
Let's close with a clear challenge you can start today. For the next 4 weeks, perform a 3-minute Medensi-style massage plus nerve and tendon gliding 4 times daily. Wear a resting splint at night and use a working splint only during trigger activities. Avoid vibration devices. Record your pain level, nighttime awakenings, and grip strength weekly. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.